Okay, so I'm really excited to be doing this talk because um, I have had a lot of knee issues playing sports and growing up, and I'm really excited to just kind of share my experiences as well as kind of what we have found that has worked in our office. A little bit about me. I grew up in Dallas. I was a competitive soccer player, went on to play at SMU, then played semi-professional, then got into marathon training. To say that I've abused my body is like an understatement. I've had multiple knee surgeries, and literally like the second one I had, I was out of college in my probably mid to late 20s. And the doctors were like, yeah, we're just going to clean it up. And, you already have like 8 out of 10 arthritis in your knee. And I'm like, okay, but my knee doesn't really hurt that much. And I injured it. So like, I don't understand this. So, I've had since that second surgery, which I never would have had, I've had a lot of issues in my knee and have been doing a lot of things to help manage it until recently where it was getting a little bit worse. And we first got our first shockwave unit, the first one, which is the radial shockwave that'll like help like with basically what happens a lot of times in the knee is you'll get degenerative tissue around the knee and that pulls on the knee and that can make it feel like it's very arthritic. And so I went and did shockwave treatment. I was like, oh my gosh, it's crazy how much damage I had because I could really feel it. And this is after me like working on it, having my PTs work on it, doing soft tissue, deep soft tissue massage. I just couldn't get my muscles to even fire around my knee until I did the radial shockwave. And so when I did that, I was like, oh my gosh, I actually can do a squat and a lunge and my knee doesn't hurt and I'm able to run again. And that was really exciting. But 2 years later, I started feeling like, oh, I can feel some more bony changes. And honestly, I've had three of my friends, and we're like low 50s is our age, are already having total knee replacements. I'm like, heck to no, I'm not going to do that. And then we ordered this Focus Shockwave, and that really helps. We're going to talk more about it, but it really helps to basically bring blood flow back to like bones and structures, even deep. Like um, it can go pretty deep into the joint with the Focus Shockwave, and so that's like a lot of times what really happens when we have issues is it's like a lack of blood supply. The body has stopped healing, and then you start getting pain, and this will actually kind of energize that. But I did 6 treatments on my knee, and I was like, oh my God, like it's the best my knee has felt. And all of a sudden, I'm like, why is my hip hurting? Because your body only feels what you've like the main thing, and my knee's always been an issue. And so that's kind of my story of why I got this. I mean, I'm just like all my other patients. Like we just want to be active as we get older and we don't want to stop. And I'm in that same boat. So I'm always looking for things that I can do and I can bring to the table. And that's kind of what we're going to be talking about today. So let's go get into a little bit of the causes of knee pain because there is a little bit of an art to what we do. We have done like shockwave on probably 7 knees since getting the Focus Shockwave, which we got like in December. And honestly, we've used it in 7 different ways based on our evaluation because it really just kind of depends. Everyone's a little bit different. But when we look at causes of knee pain, there's a lot of things that we have to look at. It can come from the back, where you have decreased mobility in the back and it can kind of create knee pain. We can have issues in the hip that also create knee pain from a mobility issue. We can get issues in the ankle that can create knee pain, and then obviously in the knee. And so when we go and evaluate someone, we're really looking at the whole body and how does it move? Because if you can't move in one area, you're going to compensate in another area. And so we really have to fix some of those issues to get us feeling good again. But we also have to look at muscle imbalances and movement habits. We also need to look at muscle tightness, degenerative tissue, really common as we get older. You can have issues in the hips, the IT band, hamstrings, quads. But we have to really get down to like, why is it getting tight? And that's a lot of things. And that comes into like movement habits and imbalances and those kind of things, but also is degenerative tissue is a real thing. I mean, that was my story. Like I couldn't even, no matter what my form was like, I could not get my quad to fire on my right side. And so it wasn't until I did Shockwave that really kind of helped with that. So we look at all these things. Other things that can happen, I mean, you can have like back and hip issues, like literally like a herniated disc or that can refer down. I mean, we had people that had back issues and they had no back pain, like maybe back stiffness, and all they had was pain in their calf. And then you start asking them questions, you're like, okay, that's not a calf issue. And so we figured out that it actually was a herniated disc. They had no pain in the back. The way people present is all over the place. And it's just like asking questions and kind of figuring a lot of those out. So again, when we look at pain location, it really gives us a lot of information. So decreased mobility in the knee, this can mimic a meniscal tear. Really, really common. I always say, like, if you're of a 40, you rarely are going to have a meniscal issue. Usually it's something else. And it can, when you have reduced mobility in the knee, we call them like knee derangements. You can literally like step and all of a sudden the knee feels like it's going to give away, very similar to what it would be like in a meniscal tear, but it's not that. It's actually like a lot of times what happens is we have fat pads in the front of the knee. They can kind of get dislodged, creating some issues. We literally had a person that is loves to do like half Ironmans and hasn't been able to do it since an accident 3 years ago, had a knee surgery and it didn't work. And she hasn't been able to run or do anything since then. Came into our office and I'm like, dude, this knee's not moving. We just need to get it mobilized. But we had to actually mobilize it and like with some sort of rotation so we could get into extension. She's back to running again. She's skiing and doing all these things. And these are things that can kind of mimic those meniscal tears. She never should have had that surgery. Because that wasn't where the problem was coming from. So again, our first phase is always looking at mobility. When you get pain on the outside of the knee, these issues, we start looking at like your IT bands. There's a lot of muscle imbalances when that happens. Is the hip not moving very well, which is creating you to use the outside of the IT band for that stability? Is there a weakness issues that's making you use that IT band? The tib fib mobility, huge. Oh my gosh. We had someone that had like lack of tib fib mobility and scarring. And I just could tell, and we're like, yeah, let's do some shockwave on you. The doctors wanted to do a total knee replacement on her, partial. They said her knee was actually horrible. And when I looked at her, I'm like, this is nothing to do with your knee joint. Your knee joint's actually totally fine. You just have a lot of scarring around this tib fib. And sure enough, that's where it was. Like, even if we tried to do some shockwave into the knee joint, no problems, no issues. It was all down like around where her tib fib is. So again, this can create poor recruitment of muscles, decreased mobility in the hip and the back. Also can cause a lot of these issues. When you get pain on the inside of the knee, again, it comes into poor recruitment of muscles. So a lot of times there's a lot of muscles that go down and attach just below the knee, and it can give you pain in that inside of that knee. It feels like, oh my gosh, it's my knee joint, but it's really not. Usually there's tightness in the adductors. And again, we have to get into why are they tight? Is there a hip component? Is something, is there compensation? And we have to look at all these things because even if you just release the tightness, you still got to get into to why it's happening. And then pain that moves around the knee, when it's like it can be here and it can be here and it changes. Those are very common things that we have to look into the back. So again, before we do anything, we have to figure out what it is, because you can go in and do shockwave on someone and not have an evaluation, not really understand it, and you could be using it completely wrong. Or maybe it's something that you don't even need. And we are very honest with that when we do an evaluation. So let's get into why medications, injections do not work. So we feel pain in three ways: mechanical pain, thermal pain, chemical pain. So let's talk about thermal pain would be like burns, sunburns. So we're going to take those off the plate. Mechanical pain is how does the knee move? How are the joints moving? The muscles, that's the mechanical pain. And those, mechanical pain can be constant. It can be intermittent. A lot of times, we'll ask questions like, does the pain come and go? Yes. Mechanical pain, 100%. Does the pain change when you move positioning and those kind of things? again, mechanical pain. So we can ask questions to determine like, okay, yeah, you totally sound mechanical. This is something that we definitely can address. Chemical pain would be like when you sprain an ankle and you get that inflammation and you have that constant aching, throbbing type of pain. You can't change your position to make it better or worse. And so this is when chemicals can treat chemicals. So when the doctors say, okay, you need drugs or medications, and or they say we need to do an injection. If your pain comes and goes, and if you can change your pain by how you move, the drugs aren't going to help you. You're basically just treating a symptom of pain. You got to get to why is the pain there to begin with. A good example that I love to share with people, and they kind of get it, is like when people have like a kidney infection, so they get that constant ache, back pain. So yeah, they give you drugs to kind of help reduce the pain. But the reason why it's there is because there's an infection. So you've got to take care of the infection, and that'll take care of the back pain. Very similar with the body. We have to figure out why it's happening. Otherwise, you're just treating it with a symptom. Now, there's other pain pathways as well that we'll see with people, autoimmune conditions, autoimmune. So when you have mechanical pain, there's patterns to everything. And so we can tell when there's patterns. When there's no patterns to anything, I don't know why my pain happens. It's just there. We do an evaluation. We can't figure anything out. Everything is moving well. I start asking questions like, are you constipated? Are you noticing that you're bloating? Are you like not sleeping very well at night? Like you start asking some of these questions. And do you feel like something is just generally wrong, but you don't know what it is? They start saying yes, 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 yes. I'm like, how do you know? I've been to so many doctors. And I'm like, that's because your pain is coming from autoimmune, which is completely different. That's when you have to go and have someone work on gut health and rebalancing your body. And we have places that we send people to. Same thing with emotional pain. We see that too. I mean, both these two categories is really only about 1% of the time, but we do see it. And so when people have that emotional, like something happened in their life, and that every time they feel it, their pain's going to come. You have to get to someone that's going to be able to help them manage that. And you don't have to do it with drugs. Totally find someone that has cognitive behavior therapy that can help them address those pieces. And common things that we see with some people that have emotional pain is they'll get better and they'll be like, wow, I feel better. And then all of a sudden they're like, my pain returned. I'm like, what did you do before? Like, why did it return? Because everything is looking good. All your baselines are great now. What's going on? I'm like, well, every time I go into work, okay, what's going on at work? And then they start realizing that, oh, they're stressing with some things that are happening at work. I go, you're going to have to deal with that because that's what's causing a lot of your pain. Or you'll have people, they'll say like, I go away on vacation and I don't have any pain. And then I come back and I do. I go, well, that's because you need to deal with something that's happening here. And so we, again, have places that we send people to that will help them manage that. But they're all pieces of you got to get to the source of what's going on. And so I always like to mention those pieces because people don't really mention those very often. So what does the research really say on MRIs like with a knee? I am like not a fan of MRIs. MRIs I think are good when you have some red flag symptoms, when things don't really make sense. I usually tell patients like if you feel like that it's going to change, like asking the doctor, is this going to change the course of our treatment? If they say no, they just want to check it out. I go, I wouldn't spend the money on it because it really doesn't help us. Because when you look at the research on MRIs, it's not great. So if you take people that have no pain whatsoever, let's just say there's 100 people that have no pain and they all get MRIs. 60 to 80% of them are going to show something, from meniscal tears to degenerative changes to arthritis, you name it, they're going to show it. And what happens is that as we get older, we tend to show things like the wear and tear on the bone and the structures is like similar to us getting wrinkles on our face. It's just a part of aging. And so if you have people and you're pain free and 80% of them, and that's all, like when you're younger, it's going to be a little bit less. When you're older, it's going to be more. That number goes higher. You're going to find things. Is that really what's going on, or was it already there? And that's where, doctors don't have a lot of time with people. They like have a 10-minute conversation. And so their solution is let's do the surgery and oh, that surgery was perfect. We did our job. Like, I don't understand why you're still hurting. And so then they'll start blaming arthritis. I mean, we see this time and time and time again. So I don't really like to rely a lot of information on MRIs. Now, if you're a kid and you're, 15 years old and you have an injury and they do an MRI and it shows like a meniscal tear, I'm pretty sure they have a meniscal tear because when you're younger, it's not going to show anything. It literally shows things as you get older, or if you're younger and it really does show something, I am always like, yep, they probably have it. Let's check it and make sure. But I'm pretty sure that they're going to need to have surgery. We've had a few kids come through our office that had stuff, mostly like labral tears in their hip. I'm pretty sure that's what it is. And we tried to
Mhm.
rehab them, and they still would get caught. And I'm like, yep, think that's exactly what you need. But as we get older, a lot of times it's just wear and tear, and that's not necessarily where your pain's coming from. And most of the time, when people come into our office, they're not sure what they did. It wasn't from a fall. And those are the cases where if you get to someone that kind of understands how the pieces of the puzzle work, those are usually things that you don't even need surgery for. So, what are some things that other healthcare providers miss? So, lifestyle changes. What are you doing repeatedly that's creating your problems? So, let's take running, for instance. If you're running and you're constantly like shifting your weight one direction all the time, the body doesn't like that. Like over time, you're going to have problems. So if we don't fix that piece of it, then you're going to still have problems. So we had someone that had back pain is a perfect example. Back pain, hip pain. They were a cyclist, and we solved the back pain. The doctor said that they were going to need to have surgery, and he was like, "Nope, don't want it." Found us. Well, we fixed the back pain, but every time he would go cycle, he would still have it. I'm like, "Okay, let's bring your bike in." And we brought his bike in and we videotaped him in slow motion. And what we saw was just a slight hip dip, just a slight hip dip. I'm like, dude, what's going on there? So we went and started investigating that a little bit more, found out like hamstrings aren't very strong. So what he was doing, he was using his quads to get the motion on the bike, which was making his hip dip a little bit. So we added some strengthening to the hamstrings, and then we had him ride his bike where he had to like keep his hips level as he was riding it more on that one side. Within like a week or 2 weeks, he no longer had back pain. So again, what are you doing repeatedly that's creating some of your issues? We've got to find what that is. Most people only look at the side of the pain. So if you have knee pain, they're only going to look at the knee, and that's it. Very common with doctors, but we all know like there's so many different sources that we have to look at, especially with the knee, because if something's not moving in the ankle or something's not moving in the tib fib, it's going to affect the knee. If something's not moving in your hip, it's going to affect the knee. And so we've got to look at the whole picture to really figure out what's going on. They only look at the injury one way. And so, like, I'll give you here's several examples. Like, you go get a massage, they're only looking at the tissue. But again, I have to ask, well, why is that tissue tight? And if you don't get to why it's tight, that's why you have to keep on going back to get a massage because you're just treating a symptom. The tissue's tight. We release it, but it comes right back again because you're not fixing what's going on. Now, I love massages. I think massages for recovery are fantastic or amazing, but just like if you keep that in the back of your mind, like I keep on having to go back because it keeps on returning, there's something else going on. You're just treating a symptom. Or like most PTs, they only come in and they only want to do strengthening. So let's go and do strengthening. Again, you have to see how the joints move. If they aren't moving, you're not going to get certain muscles to fire. And so only looking at strengthening is just a component of it. Or doctors only looking at only doing injections because that's all that they can do, or doing stem cells. I would say same thing. Chiropractors, they'll get the mobility piece of it, but they won't do necessarily the strengthening piece and get in the understanding of what you're doing throughout the day. So it's really finding someone that can put all those pieces together. Again, for doctors, only look at imaging and basing their decision off of that. It's the worst thing that you can do, especially as we get older, because everyone's going to show something.
Okay.
So here's a success story. So this was someone that came into our office. He was a 62-year-old male, suffering from knee pain, and went to the orthopedic surgeon. And then they said, "Yep, we need to go in and do a meniscal. You have a meniscal tear. We need to go in and do that." And he basically was. What was happening was he was taking care of puppies and he was kneeling on his knees. And essentially what happened was the fat pads kind of lodged into his knees. And his wife was like, "Please, please, please go and see this office before you have surgery." And so he said, "Okay." I think he even had the surgery scheduled. So he came into the office and we're like, oh yeah, knee's not moving. Showed him some knee mobilizations. Within like a couple of visits, he goes, I don't need to have surgery. I'm like, absolutely not. And so we were able to show him that. And then we started working on some of the strengthening and then we worked on other parts of his body. But he literally had surgery scheduled and didn't need it. And I can tell you very similar, like other things like total knee replacements, same kind of thing. They have research with total knee replacements and they basically put him into these people were all waiting to have total knee replacements. They put him into two different categories. One that had needed knee mobilizations, similar to what we do, and then one that was general exercise. So if they didn't need mobilizations, they put him into general exercise. Of the people that were in line for total knee replacement, 40% of them no longer needed the surgery because the knee mobilizations are what helped them, which is what was happening here. So if you look at that, there's a lot of things that we can do to help avoid some of these things. Other things that, when you look at like a knee scope, I don't think anyone over 40 should have a knee scope just to clean it out. Because if you look at the research on that, again, horrible. They went and did research where they basically poked holes in people's like so it looked like they had the surgery, and then they did the surgery on other people, and they followed them over the year. And the people that they just poked holes in that they thought that they had surgery actually did way better than the people that actually did have surgery. So the more you mess with your knee, the more problems you're going to have, which is again why I wish I never had that second surgery. If I were a PT back in the day, I probably wouldn't have, or I would have done a different surgery.
So did
So
that
let's,
last person have shockwave?
what the last person? Oh no, he didn't
No.
have shockwave. All we had to do was knee mobilizations and they were gone.
Okay.
Yeah.
And then how do you do the assessment? You're just watching people's movements and saying,
Yeah, so
does it
we
hurt? It does not
we
hurt?
yeah, so we go in and do a thorough
Hold
like
on, I gotta check.
questioning. And then we'll go in and we'll move them. We'll move their back, we'll move their hip in a lot of different ways. We move the knee, we move the tib fib, we move the ankle just to see how things are moving. And so if we notice that there's something that's not moving, we start there first because a lot of times that can solve everything. So we had someone that came in like that I talked to, like this was recent, came in, was a triathlete, and she had an accident. So she fell off a golf cart and the golf cart I think hit her knee, and so all of a sudden she didn't have her knee couldn't move, and so the doctor thought it was like, oh yeah, this is just a meniscal tear. She was in her 40s, and I was like, oh, I bet there it was just a like she just needed to do some knee mobilizations. She had the surgery. They tried to get her range of motion back, never could get her range of motion back after the surgery. Actually made her worse. uh, Came in to see us 2 years after the surgery recently. And I looked at her thinking, oh, yeah, probably maybe we'll do shockwave on her. And I'm like, nope, we just need to mobilize the knee and you'll be good. You don't need shockwave. And as soon as we mobilized the knee, and we had to like literally like rotate her knee as we're trying to pull it into extension and everything. You could just see her alignment straightening up with the mobilizations. Did not need shockwave and moved on. And now she's running. So now she's at the tail end of everything. We've got her back to doing a run walk. And we're progressing her that way. And then just checking her knee motion to make sure that it stays. Another person that came in had her doctor said she needed total knee replacement. And we went and assessed her. And I was like, yeah, you're going to need shockwave. Did shockwave on her. And she's a soccer coach. And so she couldn't play with her kids that she was coaching. And that was killing her. And after probably 2 treatments in the shockwave, she was like, I don't even notice. My knee's not giving away. And I'm striking the ball and I'm not having problems. I'm like, amazing. And she's almost done with her 6. I think she has like one more left. But yeah, we will be very honest if we feel like this is something that needs to happen or not. Um, okay, so why do we use shockwave therapy for knee pain and arthritis? So it can speed up the healing. So if someone did have an injury, you definitely can speed up the healing because essentially when you do shockwave, it's like flooding, it's like starting the healing process all over again. So like if you have an ankle sprain, you get all the healing components that happen in that ankle sprain, but every time you do shockwave, it's like doing it again and again and again. And when that happens, you're going to speed up the healing without even damaging the tissue. So it also reduces the pain. Usually, in most cases, depending on the body part and the knee, we should notice a pretty significant reduction in pain in the first treatment. If we don't, then, and we're like looking and searching for places, you don't have damage in the knee. We need to go look at something else. And it'll give us like feedback on that. It reduces tendon and joint stiffness 100%. Like we had one of our PTs went and she was like, I just want to use it on my Achilles because her Achilles were so tight. And she used it on her Achilles and her mobility improved and her stiffness went away. She's also a runner. It can improve your recovery. And we get about an 82% success rate in recent injuries, arthritis, and chronic injuries. The reason why, for most people, arthritis and chronic injuries is why it works so well is because a lot of times the body stops healing. And let's just take people will say like, oh, I don't have any cartilage in my knee. Well, you can have no cartilage in the knee and have no pain whatsoever. And the doctors are like, why? Your imaging looks horrible. Why? I don't understand how you're not in that much pain. And you have other people that have like their cartilage looks normal, but they're in so much pain because the cartilage does not have like a blood supply really to it. It also doesn't have a nerve supply. So there's no pain with it. So what happens, the pain is from the structures around it. It's from your muscles, it's from your bone. And when you get pain in through there, it's a lack of blood flow. So what Shockwave will do is it basically revascularizes that area. So it brings like blood flow back to that area to start healing it. And that's what it'll take bone edema away almost instantly. Um, I did it when I first was deciding if I was going to buy it. They did treatment on my knee when I was at a conference. And I was like, holy cow, that's amazing. But it didn't last because you need 6 treatments. And so, but yeah, I was like, that's crazy. Like my range improved almost immediately in my knee and like the swelling was gone.
Yeah.
Okay, let's see. So some common misconceptions of Shockwave. Sometimes people say like I don't have time for the machine. Literally, it's once a week for 6 weeks. That's the protocol. You'll still get improvement for 3 months after that. Like when you use the focus shockwave, so we have radial and focus. Focus shockwaves actually produces stem cells, so you will get some regenerative tissue. Focus shockwave also can go all the way through the knee. So if there's anything like in the joint, we can go all the way through the joint. So if there's any kind of issues within the bone through there, you will start putting blood supply back in there and also some stem cell productions and start the healing process again because it can go that far. Focus shockwave, well, we'll get to it here in a second. It's painful. So if it's painful, we're using it incorrectly. So yes, it absolutely can be painful. So we have to adjust it for people's pain tolerances. And we always tell people, we want you to be within this range. If you're too high, it can make you really sore. If you're too low, you're not going to get enough of a benefit. So there is a little bit of like, fine tuning on that and really a lot of communication between us and the patient. It's only for chronic injuries. No, you can use it within the first 30 minutes of an acute injury. So someone that's like an athlete wanting to get back, absolutely, this will get him back 50% faster from it. It's only for tendons. It's for muscles, ligaments, bone. They even have shockwaves for brain, heart, and nerves. We've been using it with nerves. You don't feel it as much, like especially in the upper part of the neck to kind of calm down that area. And we've been getting some good results with that. You don't really feel the nerves because you have it at such a low intensity. It's the last resort. No, a lot of times this can be the first line of treatment in most cases. Again, we do the evaluation to kind of see like what's going on, and we'll give you our honest opinion whether this is, yes, we should go this route, or no, let's do some physical therapy because I think if we do some of the mobilizations, you're going to feel really good. And then we can kind of see what happens after that. It can cause damage. Not in 44 years has it ever caused any damage. You would really need, so the lithotripter basically is the first shockwave. So they use that to basically remove kidney stones. And what they found was that you also had healing within tissues. So that's a very different shockwave type unit. They've adjusted it for the bone and for the muscles and tendons. They're very different. But yeah, it shouldn't, like, we've made people sore, but you should not have any damage from it. So again, it's a plug-in modality with an 82% success rate, stimulates healing 50% faster, stimulates and differentiates stem cells, which is amazing. Like there's actual research showing like they had an Achilles tendon and you could actually see it like regenerating, which is really cool. It increases the microscopic circulation. So a lot of times, like the blood flow is stopped going to those areas, which makes it degenerative, and it will actually revascularize all that area. And when that happens, you'll have healing that happens and the pain starts going away. It works on bone, muscle, tendon, and ligaments. So radial shockwave uses acoustic pressure waves. So it's really not a true shockwave, but it stimulates healing to injured, scarred, degenerative tissue. It's very broad. So what I kind of say is like it makes that tissue new again. So you're going to be using this through the tissue and you can find where there's damage because you'll feel it. If you feel it, there's tissue damage. So we know like, oh, there's tissue damage. So we've used it on people and go, oh my God, this is like wrapping pain around my knee. That's where I normally feel it. And you're like literally in like the inside of the quad. And you're like, that's crazy. And it's producing pain, but that's the tissue damage that's happening. And that's the referral pattern of where you feel it. So you can literally feel the tissue that you're doing shockwave on, and it'll refer up to the hip. It'll refer around into the knee. And that's the referral pattern of that tissue. So when you start healing that tissue, all that goes away. Focused shockwave uses high energy sound waves to target tissue. This is the one that produces stem cells, collagen synthesis, and does bone healing. So really it kind of treats that underlying pathology. Focus shockwave is like a pen. And so you're literally like you're on the areas where, okay, I know this is an area that's damaged. You can kind of figure out where those areas are with a radial shockwave, but also with our evaluation, we pretty much kind of know, and you'll hit it and you're like, yep, there it is. And so it's like a pen. So if you're having to search and figure out like I can't find anything with the focus shockwave, you don't have any bone damage, which is good. We can at least let people know that this is not an issue. It's something else. So again, when we use the combination of radial focus and we have like a PMF, which basically helps flood the area. So it's a pulse electromagnetic field that helps that microcirculation and detox. It's like where all the magic happens with this. So this is the person I was kind of talking to you about a little bit. The doctor said she needed a total knee replacement, and she came in. And after 2 visits, so she's a soccer coach. She no longer had her knee no longer gave out, and she was starting to play 5-on-5 soccer, which is actually crazy. And so she went from like thinking that she might need a total knee replacement to feeling really, really good. It is right around there. And when we look at it, so if we look at like the unit in the middle, that's the focus shockwave. And so we have this, you can see it looks kind of like a little bit of a gun. So there's different heads to it. So when the head that's right there that's on it, that basically is going to target the tissue at more superficial. But when you take that off and it's basically a flat surface, it can go all the way through the knee joint. So we can hit varying levels of the tissue based on kind of what's going on by putting like kind of different heads on that. So that's the targeted one. And then the ones that are all around it, that's the radial. That's where we're going through the whole entire, like quad. Usually the quad is what is the worst. Anytime we try to go into the hamstring ever so often, usually not an issue. Sometimes we have to go into focus to hit the tendon of like maybe the hamstring. But for the most part, almost everyone, like it's part of their quad, whether it's the whole part of the quad or it's just the outside of the quad, is usually an issue. And that's where we use the radial shockwave. So the mechanisms of shockwaves on human tissue. So inflammation and damage removal. So shockwave is a pro-inflammatory initially, and then it promotes the catabolic process associated with removal of the damage. So basically think of like you come in, you flood, like when you have an injury, you flood the blood flow in there, which has all the healing components, and then you're also taking the damage away. That's what shockwave does every time you use it, which is why you can speed up the healing. And it has a repair process. So like it actually will make the tensile strength of your tissue even stronger than if you were just trying to remodel it with like just exercises. Vascularization. So you're basically flooding that area. You're revascularizing that area so that you again get the blood flow back into those areas so that it can start healing that way as well. And it, again, like what I said, it increases tendon strength, collagen synthesis, neurovascularization account for like long-term benefit use. Does all those things. So here's someone, she initially came in for her TMJ. but then also had knee pain. So it's interesting that she says, so like when people say like they want to get PRP in their knee or they even want to get stem cell, if you actually decide that's the direction that you want to do, you actually want to use Shockwave first because Shockwave, so think of like a degenerative tissue like a dry sponge. So you're going to inject into that dry sponge and it's not really going to soak up anywhere. So if you're going to do, like a stem cell or you're going to do PRP, it's not going to really absorb in there. So what Shockwave does is it makes it like a wet sponge. And so when you go and inject into a wet sponge, then you're going to get all that absorption of what the doctor is putting into you. So it's really good if people want to go that direction to use Shockwave before they go and do these injections. But the interesting thing is that she literally describes that in her jaw. She had so much scarring in her jaw from a previous surgery that went wrong that the doctors couldn't inject in her to do any kind of mouth procedures. So they sent her to our office to see if we could help her. And I'm like, we're going to do Shockwave. And just, she had no limitations whatsoever. I just knew that she had a lot of scarring and they couldn't do it. So we did Shockwave 4 treatments. And I said, let's go do the procedure and see what happens. And then if we need to do more, we'll do more. So we did 4 procedures on her and they were able to actually get the needle in there with no problems. But she had such great success with that. She decided she wanted to do her knee as well. So here is her testimonial.
And I had had a root canal done 30 years ago that was done by a dentist who really shouldn't have done it, caused a lot of injury. That's probably where the scar tissue developed. But anyway, so I went into Empower and I had my first Shockwave treatment, which is it's an interesting feeling. It doesn't hurt. It's just a kind of a knocking on your skin. And immediately after the first treatment, my entire jaw felt like a wet sponge. I couldn't describe it any other way. Something was going on in my jaw. I could hear it crunching in my ear. I knew something was happening. I don't know why, but for some reason, both insides of both of my knees began hurting a couple of months ago. I felt a little bit of instability in my knees, and my mother has gone through unsuccessful knee replacement surgery. They cut her MCL. I know I'm very familiar with what the MCL can do. So I just kind of thought something has happened on both knees. What have I done? So we start working on the knees, and as you're working, I'm feeling sensations up into my upper thigh. So yeah. I know there's something going on. And after one treatment, my knees felt better. I was rid of the pain was gone, and I haven't had any more of the instability, which felt like I was going to lose control of my knee. That has gone. And
so that's a quick testimonial on
I don't know why, but for
Shockwave. So when we look at this, like the cellular effects of what's happening with Shockwave, these are big words. So basically all we need to know on this, it promotes tissue regeneration. So it stimulates growth of new blood vessels, which is what that revascularization is happening. And then when you look at the bone morphogenic protein that enhances that, it's just enhancing bone formation. So again, it's like re-stimulating the healing process, even in the bone. And it has an anti-inflammatory effect by modulating the expression of the interleukins. So basically what all that is it decreases inflammation, increases immunity, and tissue regeneration. So these are all things that it starts stimulating to, again, get that tissue back to functioning again. It has almost an immediate pain relief, and the reason why this happens is, there's a lot of things. Essentially, it stimulates the central nervous system. So like when you look at decreased substance P release from the treatment area, this is like how the body communicates with each other. And so it like stops that communication. It actually does like a reset in the body. And so ultimately, for the most part, all this really means is it takes away the pain initially. Now, some people, the pain will kind of slowly come back, which is why we do 6 treatments, because you'll get the best at like visit 5 and 6 is when you really start noticing, especially when you're using focused shockwave, when you start noticing the real improvements that are lasting. So, where can we treat? I think we talked about a lot of this. Most evidence is in tendon bone healing, Achilles, plantar fasciitis, patella tendon, trochanteric pain, shoulder, elbow pain, muscle and ligaments, chronic and acute, muscle tears, degenerative tissue, ankle sprains. We can speed up the ankle sprains. We had someone in our office recently that had a pretty massive ankle sprain, recovery from sport, lower back pain, SI joint pain, but also thoracic and cervical as well. But usually we'll only use the radial. You don't want to use focus definitely in the thoracic because it can go so deep, you can puncture lungs. I will use it in the cervical and the upper parts, but that's usually when I'm just trying to treat the nerve overall. Osteoarthritis is amazing. Fingers, knees, hips, ankles, amazing, amazing. The things that we're able to do, yeah, I'm just like shocked. So again, 6 treatments once a week. Usually the first treatment, you'll be hopeful that the results for most people, especially with the knee, it's like, oh my gosh, if I can't, like, I actually feel like this is going to help. Sometimes in visits 2 to 4, you'll start wondering, like, is it working? I kind of feel it again. I might have some bone bruising. We've had that on some people, but not others. Visits 5 and 6, you'll notice much better results. And this is common for most people, not everyone, but most people. Even if you're 50% better, we still want to wait 3 months to see the full effects of the stem cell production, the collagen, the protein synthesis. So what happens is when people go through the whole process, we do a 3-month checkup where they come back in and we just kind of check and see how they're doing, if we need to do a tune-up or, yep, go off and keep on having fun. So osteoarthritis in the knee, I think I talked a little bit about this, but osteoarthritis is defined as a disorder of the synovial joints and occurs when there's damage that triggers the repair process leading to structural damage within the joint. So repetitive excess loading, stress to the joint over time, injury, really common when you have injuries or surgeries. It messes with things and you do repeated things. You end up having issues down the road. The repair process will alter the structure of the joint over time. So you can get localized loss of cartilage. The cartilage loss is usually not where you get the pain. It's when you have bone issues. So remodeling the adjacent bone formation in the ossiphytes, which is new bone at the joint margins. Mild synovitis is common too. So you'll get inflammation around the synovial membrane that lines the joint capsule. So we've seen a lot of this with people. The pain that you'll get from stuff like this is really the pain in the structures around the knee. And that's what Shockwave will help repair. So let's talk a little bit about the science of this. So focused shockwave therapy reduces the progression of knee osteoarthritis in rabbits by reducing nitric oxide and chondrocytes, which basically is cartilage cells that are dying. And so nitric oxide is a major inflammatory contributor, and that drives the pathological change and progression of osteoarthritis. So when you look at using shockwave with the progression of osteoarthritis in rabbits, the effect may be related to basically decreasing the level of that nitric oxide and likely a mediation by reducing the chondrocytes that you'll have. So it becomes, again, a lot of this stuff too is that increased blood flow that goes to those areas. But the nitric oxide is honestly part of the inflammatory process that happens. So here's another one on treating the knee of osteoarthritis. It was a systematic review. So the results showed that Shockwave group had significant improvement in pain relief compared to the control group through 12 months, which is great. It's a year. The patient shows significant improvement in physical function at 6 and 12-month follow-up when compared to just the control group that didn't have it. And then basically the conclusion of the research was that Shockwave treatment for OA had significant beneficial effects on pain relief and physical function improvement for up to 12 months. So people always ask me, how long is it going to last? And I'm like, I don't know. I've heard like 2 years is a good indication, but if there's like some underlying pathology that's in there, then maybe like it's not going to last as long. So like, I'll give you an example. We have a client that had psoriatic arthritis, both knees, horrible knees. She's literally trying to find some relief. We did Shockwave on both of her knees. She was like, I feel so much better. She had a lot of soft tissue tightness because she hadn't been able to straighten her knees for so long, but her pain went away and she's been doing fantastic. The problem is she has the underlying pathology of the psoriatic arthritis that if we don't take care of some of those pieces, which we've talked to her about, trying to get her to our naturopath doctor who can kind of help, because it's an autoimmune type condition, kind of helping that piece of it, she's going to get longer effects. So we try to give people enough education to help them, maintain it as long as possible. Other things, stress fractures. Oh my gosh, so amazing. Basically showing that using the focused shockwave has showed excellent results in treating stress fractures with a faster return to competition and athletic activity. We had a guy that came in that had basically a stress fracture where his like patellar tendon was. And they tried PRP and a bunch of stuff. And we did shockwave and he was like, holy cow, that's amazing. Like I've had more relief just doing the one shockwave that we did, compared to anything else that he's done. So again, why do we do shockwave? How shockwave compares to PRP and stem cell. So PRP, way 100% better. You're going to get better results with shockwave. Stem cell is pretty expensive. You can do stem cells with shockwave and you'll get better results. Same thing with PRP. But honestly, most of the time when I see people going in and getting stem cell, I'm seeing about a 6-month process where they're getting results in about 6 months. This, we should be getting results from a year to 2 years. We don't have enough. I don't have enough data with our patients that we have because we just got it. But we'll be getting more and more as we go. So basically a step-by-step treatment strategy is, we want to first is like do an evaluation so we can figure out kind of what's going on. If we're like, yes, shockwave is something that you do, we will either do the beamer or the PMF before or after, doesn't matter as long as it's in the same day to really help that microcirculation, bringing nutrients, to the newly revascularized area. We'll do radio shockwave around the tissues, around the knee. A lot of times, again, we find a lot of damage. We do focus shockwave to treat like the bone and any parts that are like, sometimes you'll find like radial will be like, whoa, I can really feel that. We can use the focus shockwave and it'll be way less tender, especially if it's close to the bone. The radial shockwave does not feel good when it's close to the bone. So if we know that there's some issues there, then we'll use focus there as well. And then physical therapy to retrain the muscles, to get you back to feeling great if there's anything that we find that is needs to be addressed. So we have other resources. I think you'll get an email that will have our like a lot of people like to hear things. Some people like to read things as well. So we have a whole a regenerative therapy chronic arthritis kind of like ebook. So that will also get into some other things. You'll get that in an email after our event as well. So we do have a special offer for those that have joined us live. We have a thing called a free discovery visit where you actually can sit down and talk to the physical therapist about kind of what's going on, get your questions answered, really just kind of helping you make a better decision. And then if you decide that, yep, I want to move forward, 15 days from this, it has to be scheduled. You'll get $100 off the evaluation price. And you'll also get a copy of my book that I wrote probably 2 years ago on kind of like all the different sources of pain. And I basically kind of shared patient stories, so that people can kind of see themselves in that. And then you'll also get, if we decide that shockwave is what you need to do, even if we decide later, you can still get the $50 off your first treatment of the regenerative shockwave treatments. If we decide that, nope, let's go this route. And then like, okay, nope, let's go ahead and do shockwave. We'll still honor that as well. So that is it. I'm going to stop the recording so that we can answer any questions. Great.
Okay, so I mean, would you what is the cost of this? I mean, I like that there's some money off. How much is this?
So with the knee, it's the valuation. Our valuation price is $300 for an hour. We recommend, I mean, you can do a 30-minute, but man, with the knee and just looking at everything, we recommend going for an hour. And then we can basically decide like, yep, you're a good candidate, or nope, I think that we need to go this route first. So that's what that cost is. The shockwave cost We have packages. It's just 6 visits. On the knee, we use both because it just works really well with both, and that is $399 a visit. But we have a package where you can buy 6 that will also give you, I don't know what the price, like 15% off, 12%. I don't know. Some percent off. I don't deal with those. The front
Oh,
office
okay.
does for the most part. But yeah, so there's that as well.
Okay. All right. Very good. Well, I like what I hear. I think I'm going to go ahead and set something up in the next couple days to get something scheduled.
Yeah.
'Cause
I'll
I'd
get
love to come in there and solve my knee issues.
Yes, yeah. And I'll just have Victoria reach out to you so she can get that scheduled. That way, yeah, we can kind of start from there. And
Yeah.
the process is like we just take it one step at a time. So we want to make sure like you're comfortable with each step that we do. So we always say like start with a DV, and then if you're like, yep, this is what I want to do, then go to the evaluation. And then we talk about what that looks like. Yep, this is what I
Um,
want to do. So you're a part of the process the whole entire time. There's no pressure in anything that we do. We want to make sure that you're making a good decision for yourself.
okay. Very, very good. It sounds great. I look forward to it, and
Yeah.
I'll look to forward to hearing from Victoria. Are you guys open Monday through Friday, or are you
Monday
only
through
open?
Friday.
Okay. Because I do travel, so sometimes one week I may not be in on Monday through Thursday, that kind of thing.
Oh yeah, we can work with that. And as long as like, so usually the treatments are once a week. Even when we do like
Mhm.
PT, we just do once a week. Because we'll do a lot of manual and then we'll like, this is what we want you to work on for this week. And then if you come back in for PT and like that's the direction we go, we reassess everything. Okay, this looks better. This looks better. Okay, so now we're going to continue to work on this. Now this is what we want you to work on. So we operate very different than most other offices. With Shockwave, it's once a week. You want to get them in within like we say 7 to 10 days, so you can kind of manage it that way, but they do have a cumulative effect. So if like you're gonna, especially at the very beginning, I think if you like miss, not that you're missing a treatment, but like let's say it's like 14 days or something and you're toward the end, I don't think it's going to be as big of a deal as the beginning.
Yeah. Okay. All right. And then two really medical questions.
Yep.
Does this, and I don't know if I have this or not, but does this work out with Baker cyst at all?
So Baker's cyst basically is when you have issues in that knee joint and it's leaking out in the back. So it may actually, I have not used it on someone that has a Baker's cyst. But usually when people have a Baker's cyst, there's degenerative changes that are happening. So we can go in again if we feel like, yeah, there's something going on within that joint, we can like the unit can go all the way through the whole knee joint. So if you can start healing some of that stuff, it's going to reabsorb some of that
Okay.
material. So, but we haven't seen it because no one that's come in with the knee stuff has had that.
Okay, gotcha. And then I remember on my left knee, it's like 3 months after the surgery, I was running and it would like hurt. And I went in the MRI and my doctor said, "Oh yeah, you got a hanging piece of cartilage and that's going to fall off eventually. I can operate on it, but it's going to fall off." And sure enough, it went away. So I assume
Yeah.
it just fell off.
Yeah, so you can get like pieces, and this is why like even going in and cleaning up, it doesn't make a difference because um and a lot of times if there is a piece that is like giving you a little bit of problem, a lot of times we can mobilize the knee and it'll flush it out. And then it's like it's gone and your body reabsorbs it. And so this is why I'm like this usually just doing a knee clean out, it doesn't work. It
Mhm.
just like the more you mess with it, the more like you have problems later on. That's essentially what
Okay.
they did to my knee in my 20s. And I was like, I'm pretty sure like I tore part of my AT band, but they wouldn't believe me. If I was a PT, I would have been insistent. I would have come in and like, because that's where I have a lot of like scarring. And when you have scarring and use focus shockwave, woo, you can feel it. Like, it's just different. It's a different kind of pain. When you use the focus shockwave, you have to really go down. And that's usually when I'm like, oh, you have a lot of scarring in this area. And I only know because that's how it was with me. And there's the soccer player that or the coach that we treated. I was pretty sure. I was like that your joint's fine. Like we haven't even got to go through her joint at all. We've done everything around like the lateral compartment of like her tib fib. I was like, I think it's all just scarring through there. And she was in like, oh my God. I'm like, yeah, let me go down. She goes, no, no, I can take it. I'm like, no, we're going down. It was a lot of scarring, but it went away. I mean, like, we're having a harder time. She's on like her fifth treatment, I think, this week. So she's having a lot. We're having a hard time finding spots, which is great. It means there's been a lot of healing when before it was like everywhere.
Oh, wow. Okay.
Yep.
All right. Well, thank you so much, Stephanie. Look
No
forward to
problem.
working with you.
Yeah. Awesome.
Okay. Have a good one.
You too. Bye.